it offers huge opportunities, particularly for us as the old structure and edifices of the NHS start to, if you like, fall away and lose some of their dominance over the system. We see that we're already very much in tune with what gives for good patient experience, what enhances outcomes, and still maintains the quality of care that people need and need to be assured of. And so our opportunity to work with the new commissioners that are emerging, excuse me, and very much be part of that transformation is very, very exciting for us.
There have been concerns expressed that the independent sector will come in and effectively cherry pick. I mean, what do you say to that?
Well, what we say with that is that we see ourselves and have always positioned ourselves as long-term strategic partners with the NHS. We're not about sort of taking out sections of the NHS. We're about helping support and transform the NHS and work with the NHS in an integrated way. I think the key premise for us, the key driver for us, is what is safe and sustainable for patients in their own home. And clearly, there are certain things that can only safely and sustainably done within a hospital environment, but we can challenge and do those things that can be delivered safe and sustainably in the community. With regards to the cherry-picking accusation, I think a lot of the way we work is actually with commissioners. Which patients do they want to see cared for in the community? If we're looking at early supported discharge, for example, where we're able to take patients into their own home to complete the inpatient phase of care, we need to make sure that that is both clinically safe but also makes economic sense. If we've got somebody who's on a 4 times daily antibiotic with an infusion that goes in for several hours, it probably doesn't make a lot of sense to change the model. But if we're looking for somebody who actually just with regular help and support we can sustain very safely in the community, that makes an awful lot of sense indeed.
There will be more competition for you as an independent provider as well. How concerned are you about standards of quality remaining good?
I think for us that's one of the basic planks on which we build our business. We are creative but we never compromise on quality. To respond to your point about competition, I think that we need to make sure that the system works with the any willing provider opportunities, but in a way that sitting with the commissioners, that standard of quality is not compromised in a way. I think what I'm anxious, if there is an anxiety, is that we get the broad spectrum of what is on offer and that there isn't just a shift on price. I think one of the concerns might be that at the moment with that big figure of 20 billion over 4 years to be realised, that there might be a sort of lurch towards money chasing rather than actually that very parallel track of quality and economic efficiency and savings.
But in terms of the patient, what benefits do you think there will be?
Oh, I mean, give you some real benefits, not what I think they will be. I mean, for the patients, particularly, for example, where we're providing chemotherapy in the patient's home, we are transforming life. You know, instead of it being a whole day to get to where you need to be, to wait for the drug to be made if you've turned up, and then sit for hours whilst you have your treatment, then to only repeat the long journey home. You know, we are transforming that already. You know, we treat patients in their own home. Similarly, the predictability about, you know, we're there 24/7, we can respond. The benefits really are huge for patients. We do it as well with that confidence builder for the patients about that clinical safety and about that fallback and position the whole time in terms of that their health comes first.
Thank you.
Thank you.